1-800-449-8255. New York City, WR. Roy, go ahead. You're up on the Savage Nation. What's on your mind?
Yes, Michael. So I just had I've been thinking about what you said about, people should be able to pay for what they can afford when it comes to health care. I kind of have a tough time agreeing with that because I don't think health care is a house or a car or a boat. You're talking about people's life, and we should all have access to care. All right?
Hold on now, but wait a minute, my friend, who's supposed to pay for it, though?
I agree with you that paying for it is the challenge. Okay? I would hate to think that because I cannot afford to pay and I go and I see my doctor, the best treatment that might benefit me as a human is not going to be given.
Well, let me tell you something. Right now, you're not getting the best doctors in New York City anyway. You're not paying for it, so you're not getting it. They have closed practices the same way that any elite club has a closed entrance policy. You're not getting in to see the best oncologist in New York unless you're rich or famous. You're not getting in there. So it exists already. But you don't really think that on Obamacare they're going to take the best oncologist in Manhattan and make him treat the indigent, are you?
No, I agree with you there. But the thing is, I should have access. I should not be, the position should not be, well, can you afford to pay for the best health care?
In principle, that's what I think should be too, but I'm not a child anymore. Everything that I have in my life is graded on how much I can pay for it. When you go to a sporting event, do you think it's the government's responsibility to make sure you get box seats?
My health is not a sporting event. That's my argument. And I don't think my health...
Wait a minute, but why is your health my problem? In other words, if you made yourself sick through faulty living, why should I pay for it? Let's take it from that perspective. We're not talking about a car wreck and an emergency. You're going to go to an average hospital. You're going to get as good a care as you can get no matter who you are, whoever's on duty. But let's say outside of that, why is your health the burden of society when you, in fact, may be responsible for your sad state of health? And moreover, why should the man who has spent his entire life resisting dessert, resisting fats, exercising and not smoking, who is now 60 years old and never had a heart attack, why should he not be rewarded in some way for his health practices?
Michael, you make very good points. That's one reason why I like listening to your show. But
I'm not coming at this from the point of view of you're bad because you're this race or you're good because you're that race. You know that by now. Never mind the lies you hear. But in other words, a system is inequitable to begin with. I don't know where it's written that everyone is entitled to the best oncologist or gastroenterologist in America. Because the day that happens, fewer people are going to go into these fields, and you're going to have more mediocre people in medicine. So I have a very, very different view of medicine than you may imagine. I'll give you, I don't know, Roy, how long have you listened to my show off and on? Months, years?
No, but probably about 5 or 6 years now.
All right. When my dad, rest his soul, had a heart attack when he was in his 40s, I will never forget as long as I live. I was in Monticello, New York, summer, in his 40s, got a heart attack, goes in the oxygen tent, and the doctor comes to the family and says it's going to cost you $100 a week for my care. Now, $100 a week in that time period was like, I don't know, $1,000 a week now? We just didn't have it. But guess what? We got it together. So the principal breadwinner is sick. He's in an emergency room, rather than an oxygen tent. There's no money coming in, so we had to take it out of savings, and we had to give it to this doctor who was simply doing his rounds in the hospital. I thought that was very unfair. I thought that the government or somebody should pay for my father's care when he had the heart attack. But guess what? Nobody did. So what happens? You go on with life. Where is it written that they had to take care of me?
I just think that at its very core, you will be introducing, like you said, multi-tiered levels of health care that only the rich will get the best health care. And if you're poor, you know what? You're condemned to death. And I just don't think that we as human beings want that. We just don't want that.
Well, wait a minute. Let's again, we may not want that, but, the world is not fair, number one, and you get what you pay for, number two. I don't care what society you are in. I don't care what realm of life you are in. You're already getting different levels of treatment. And when you go out to eat, do you get into the finest restaurants in New York? You couldn't even get in there, probably. They tell you there's no table, right?
But you're probably right. But my food, like I said, I'm not...
No, wait a minute. I don't want to go to the best restaurants, personally. I mean, to bring it down to the level. I'd rather eat at home and do takeout from a Chinese joint, as far as I'm concerned. So that doesn't matter to me. But let's say, God forbid, you or I got sick right now. You'd be taken by an ambulance to which hospital in New York? Probably a very good hospital, right?
Probably the closest one.
But wait. Let's say you had a heart attack, God forbid. They would take you in, and you'd get the same exact treatment. They wouldn't know whether you were a titan on Wall Street or basically a very poor man. Nobody would know who you were unless you were very famous and your name jumped right off the page. You know what I'm saying? Or his lawyer came in with him, or he had a private ambulance come get him. But God forbid an emergency, you're getting the same treatment now whether you're very rich or very poor in this country in a hospital.
Right. I agree with you.
All right, hold on. So right now you already have a system that is very democratic. I predict that it will become less democratic under Obamacare. With the minute the government comes in and says, you must do this, and we're going to check on whether you did it, and was there racism, was there thisism or thatism, what you're going to do is you're going to drive more and more people out of medicine is what you're going to do, and you're going to have more and more mediocre people in medicine. You're going to have a quality decrease in medicine is my point. You know, like everything else, there are things that we would like and things that are real in the real world. I don't like the idea that people go into medicine for money. It always bothered me. In the ideal world, no, a man should go to school or a woman for 15 years to make nothing. Well, who's going to do that? Who's going to sacrifice and go through all of that unless there's a reward at the end of whatever kind that may be involved? And it's usually monetary. Why would a person go to medical school and 4 years more and then for another 12, 13, 14 years before they make a dime, unless they figure they're going to make $400,000, $500,000, $600,000 the first year out of that, and then maybe a few $1 million a year after that to make up for all the years that they didn't have it? That's the way it's always worked. So you got some of the best and brightest people willing to forestall their income for a number of years to make it back on the other end. They're not even going into medicine anymore. Most of the brightest kids don't even go in that world anymore. They give them a movie camera to go to NYU and they want to make some movie. They think they're all going to be Steven Spielberg. And it's one of the reasons that we've lost so many good people out of the sciences and out of medicine, because there's no instant reward anymore. So now you take the same discussion and you take it down to now where there's not even a back-end reward. You're going to have very mediocre people in medicine, which is already what we have. Take a look at your hospitals today. What percentage of them are American-born? What, 40%? 30%? Does that mean that they're not as good doctors? My guess is yes, they're not as good doctors. That's right. Generally, the third world people in the hospitals are not as good as the American-trained doctors. That's been my experience. Thanks for listening. I'll be right back.
Savage. Eddie, my love.